Hey everyone, welcome back to Blueprint Nursing Reviews. My name is Nicole, and today I'm going to share my experience at my first nursing job with you. But before we get into my first nursing job, let's take things back to the beginning of my nursing journey, nursing school. I received my ADN in Colorado, which is the degree that I held when I got my first job. I later went back to school and received my bachelor's and master's of science in nursing. I worked in a few different states on a few different medical surgical units, and then I switched specialties and worked in labor and delivery units. Let me know if you want a video on changing specialties. Anyway, back to my first job. My first job was a full-time position on a 35-bed medical acute unit in a small hospital. I worked full-time, which consisted of 2 12-hour shifts and 2 8-hour shifts a week. While working there, I worked both days and nights. The typical population had a wide variety of diagnoses, including diabetic complications, stable cardiac clients, alcohol detox, palliative care clients, and everything in between. Unlike larger hospitals that have medical units with focused diagnoses, like neuromed-surg, we were the only medical unit. This unit was a place that allowed me to practice many of the skills that I learned in med-surg class. I was one of 6 new grad hires that summer, so I got to go through orientation with other new grads. I really liked having other new grads to talk to during my orientation. I definitely felt less anxious knowing that I wasn't alone in this experience. The orientation was 6 weeks long, and I was assigned to a mentor who was my primary preceptor. I remember having extreme feelings of pride and fear in those weeks. I was so happy to be an actual nurse, but I was straight up terrified that I was an actual nurse. I promise those feelings are normal, and they did lessen as I gained confidence and experience. The shifts were varied. For example, when I started on night shift, I worked from 1900 to 0700, 2300 to 0700, or 1500 to 2300. At first, I didn't really have a typical shift because I was still learning to be a nurse. I would arrive 15 minutes early and look up my assignment so I could loosely map out my day. I'd begin by performing physical assessments for the shift. I would concurrently chart my assessments, which is when you chart your assessments while you're at the bedside, and is something that I fully recommend doing. Then I would follow up my assessments with MedPass. Following the scheduled MedPass, it would be a game of Tetris, figuring out what tasks went where depending on priority, time, admissions, and so much more. I'd round on my patients hourly and link up with the CNA assigned to my patients to see how we can help each other out. I would try my best to carve out time at the end of the shift to verify charting and make sure I did all of the necessary tasks. Oh, and how could I forget? I would start and end my shifts with bedside reports. Seriously, don't skip the bedside report. So I'm sure after semesters of med-surg class, you have a good idea of what to expect in med-surg. But I'll talk a little bit about the kind of patients I had the privilege to care for and highlight a little bit more about my typical days. My new grad year was in 2016, so this is a little bit ago. The medical acute unit that I worked on, as I said, had 35 beds. Most of those were semi-private rooms, with the remaining private rooms being reserved for patients on isolation precautions or patients that required complex care, like palliative care patients, for example. I would have to wager that a majority of my patients were patients that were in the hospital for diabetic-related complications, alcohol detoxification, post-cardiac stent placement care, and COPD exacerbations. I generally had anywhere between 5 and 7 patients at a time, depending on staffing and the unit census. Outside of the brief overview of my typical day from earlier, I would regularly interact with resident physicians on their rounds, attending physicians, respiratory therapists, physical therapists, case managers, dietary care, pastoral care, environmental services, and radiology. A lot of people, right? But it became a little symphony over time, knowing when I'd catch people, who'd be the right person to grab for a certain patient, and how I can get my patient what they needed in order to discharge. At about 6 months in, I started working as a charge nurse and a nurse preceptor and was added to the code team. I can talk more about those another time as well. I know there are so many things I can talk about with my first job, so if there's anything you want to hear more about, let us know. Here are 2 little takeaways from my experience. Was night shift more beneficial than days? When I was in school, I was told that night shift was the place to start as a new grad. I would say the main benefit that I saw was that night shift can sometimes be slower, so I had more time to figure out my time management. I stressed sometimes because there were definitely some action-packed nights, but I wouldn't say that you would have to pick one over the other to get your experience. Being okay with not knowing. I had to become okay with not knowing the answer sometimes. I became fast friends with my nurse educator, her box of skill instructions, and telling my patients, I'm not sure, but I'll find out. So it's okay to not know, but know where to go for help. Okay, friends, that's it. Thank you for letting me reminisce about my first nursing job experience with you. I know this was a super short overview, so if there's anything you'd like to hear, seriously, let us know. Otherwise, remember to subscribe to our channel to keep up on everything Blueprint Nursing and take a look at our self-paced crash course or live study groups. See you next time.